Assalamualaikum and hi. We are from Group 11. We present about Cephalosporin first and second generation. Our group consists of 5 members. So let's go to the introduction. Cephalosporin is a class of broad-spectrum beta-lactam antibiotic that are widely used to treat bacterial infections. This drug works by interfering with bacterial cell wall synthesis, then killing the bacteria. The structural and functional are similar to penicillin but have a broader spectrum of activity and more resistant to beta-lactamase, which is an enzyme that produced by bacteria to destroy beta-lactam antibiotic. There are 5 classifications of cephalosporin: first generation, second generation, third generation, fourth generation, and also fifth generation. So let's take a look at spectrum of activity for the first generation. It is very effective against gram-positive bacteria such as Staphylococcus aureus and Staphylococcus pyogenes. Unfortunately, cephalosporin first generation drug has limited activity against gram-negative bacteria such as E. coli and Klebsiella pneumoniae. Meanwhile, spectrum of activity for the second generation, it have broader gram-negative bacteria coverage such as Haemophilus influenzae, Enterobacter species, and also Neisseria species. However, second generation drug is less effective against gram-positive bacteria. Let's move to the pharmacokinetics of cephalosporin. As for the first generation, the examples are cefazolin and cefalexin. The absorption for oral formulations like cefalexin are well absorbed, while cefazolin can be used intravenously or intramuscularly. For the distribution of this drug, it penetrates well into most tissues but doesn't cross the blood-brain barrier effectively. Cefazolin achieves high concentrations in bone and is commonly used in orthopedic infections. Cephalosporin first-generation drug has minimal hepatic metabolism. This drug remains largely unchanged as they pass through the liver. For the excretion, it is primarily renal excretion via glomerular filtration and tubular secretion. High urine concentrations are beneficial for treating UTIs. Dose adjustment is necessary in renal impairment to avoid drug accumulation and toxicity. Cephalosporin first-generation drug have short half-life. Cefazolin has about 1 to 5 until 2 hours, while half-life for cefalexin in about 1 hour. For the second generation, the examples are cefuroxime, cefoxitin, and cefotetan. The absorption for cefuroxime acetyl is well absorbed after oral administration with bioavailability 40 to 50%, which is enhanced with food. While for the cefuroxime, cefoxitin, and cefotetan, it is directly delivered into the bloodstream, achieving rapid therapeutic concentration. For the distribution of these drugs, it penetrates well into tissues, including the CNS. For example, cefuroxime in meningitis. Cefoxitin and cefotetan concentrate in the abdomen and pelvis, making them ideal for intra-abdominal infections. The metabolism for second generation is minimal for most drugs, and cefotetan undergoes partial hepatic metabolism. For the excretion, it is primarily renal excretion via glomerular filtration and tubular secretion. High urine concentration are beneficial for treating UTIs. Dose adjustment is necessary in renal impairment. The half-life for cefuroxime in about 1.5 until 2 hours, cefoxitin in about 0.8 hours, and cefotetan in about 3.5 until 4 hours.
Next, we will move to the pharmacodynamics of cephalosporin. So, let's begin with the first generation of cephalosporin. Their mechanism of action involve binding to penicillin binding protein, which are very essential for bacterial cell wall synthesis. By inhibiting this process, they disrupt the peptidoglycan cross-linking, which can lead to the bacterial cell lysis and bacterial cell death, making this drug bactericidal. Next, they are most effective against gram-positive bacteria, for example, Staphylococcus aureus and Streptococcus. But they have limited activity against gram-negative bacteria, for example, E. coli and Klebsiella pneumoniae. Pharmacodynamically, this drug exhibit time-dependent killing, which means their effectiveness relies on maintaining concentration above the minimum inhibitory concentration or MIC for an extended period. Clinically, they are commonly used for skin infection, surgical prophylaxis, and mild urinary tract infection. Now, moving to the second generation cephalosporin. The mechanism of action for the second generation is quite similar to the first generation, which are they bind to the penicillin binding protein, inhibit cell wall synthesis, and cause bacterial cell death. However, their spectrum of activity is broader. They have enhanced gram-negative coverage, effective against bacteria, for example, Haemophilus influenza, Neisseria, and Enterobacter, while still retaining the moderate gram-positive activity. In addition, some second-generation cephalosporin, for example cefoxitin, are also active against anaerobes such as Bacteroid fragilis. Just like the first generation, this second generation drug exhibit time-dependent killing, requiring concentration to remain above the minimum inhibitor concentration for optimal bacterial eradication. Last but not least, clinically, they are commonly prescribed for respiratory tract infection, mixed infection, and intra-abdominal infection.
Now I will explain about the example of drugs. Firstly, I will explain about the sulfasalin sodium. Sulfasalin sodium is the first generation cephalosporin. There are few dosage for this drug. Firstly, for the uncomplicated infection, we have to take 500 to 1000 mg 2 to 3 times daily. Next, for the moderately severe and severe infection, we have to take 500 to 1000 mg 3 to 4 times daily. Next, for the severe life-threatening infection, we have to take 1 to 1.5 gram 4 times daily. And lastly, for the rarely, we have to dose up to 12 gram daily. Next, I will explain about the therapeutic effect or uses for this drug. Sulfasalin sodium used to treat certain infections caused by bacteria, including skin and soft tissue, bones and joint, respiratory tract, biliary tract, urinary tract infections, endocarditis, systemic septic infection. It is also used for certain penicillin allergy infections who have a heart condition and are having a dental or upper respiratory tract procedure in order to prevent them from developing a heart valve infection. Next, there are few side effects of the drug. For example, genital itching, white patches in mouth, loss of appetite, heartburn, gas, nausea, vomiting, diarrhea, headache, dizziness, confusion, weakness, tiredness, drowsiness, pain, redness, swelling, or bleeding near the place where sulfasalin was injected. Next, for the adverse effect of this drug, it is drug-induced fever, reddening of skin with heat sensation, and neuroptic edema, itch, Stevens-Johnson syndrome, urticaria, eosinophilia, allergic nephritis, gastrointestinal disturbance, anaphylactic reactions, pseudomembranous enterocolitis, leukopenia, thrombocytopenia, neutropenia, and hepatotoxicity. Lastly, the contraindication of this drug, it is hypersensitivity to cephalosporin and other cephalosporin antibiotics. Now, I will explain about the supraxime azathil. It is the second generation cephalosporin. There are few dosage for this drug. Firstly, for adult, we have to take 250 mg twice daily. For the urinary tract infection, we have to take 125 mg twice daily. And next, for the child, we have to take 125 mg twice daily. The maximum dose is 200 mg per day. Next, for the therapeutic effect for this drug, it is to treat certain infections caused by bacteria, upper respiratory tract, gut, skin and soft tissue infections, urinary tract infection, and pyelonephritis. There are few side effects for this drug. For instance, nausea, vomiting, diarrhea, stomach pain, rash, itching, hive, difficulty breathing or swallowing, wheezing, swelling of the face, throat, tongue, lips or eyes, watery or bloody stools. For the adverse effect, gastrointestinal disturbance, occasionally pseudomembranous colitis, hypersensitivity reactions, eosinophilia, headache, superinfection. And lastly, the contraindications for this drug is it is hypersensitivity to supraxime or any other cephalosporin antibiotics.
Okay, hi and Assalamualaikum. My name is Siti Nur Umira binti Muhammad Faizal with my ticket number of 076912. So today, I'm going to be presenting about the nursing care of administration of cephalosporin. So there are 4 parts of nursing care of administration of cephalosporin, which are the pre-administration assessment, guidelines during giving the medication, monitoring after administration, and post-administration care. The first part, which is the pre-administration assessment, nurses have to make sure the patient does not have any allergy towards the drug, and also does not take any alcohol before administration of the medication, because any intake of alcohol before administration of cephalosporin may cause disulfiram-like effect. Disulfiram-like effect can cause nausea, vomiting, flushing, and low blood pressure. Also, nurses have to do a monitor organ function exam to examine the patient's liver and kidney function, because cephalosporin can cause bad side effects to the patients if the patients already have impaired kidney or liver function. Secondly, nurses have to choose the correct route of administrations to make sure everything is at the patient's best interest. Nurses have to administer the medication at the right dosage and timing as prescribed by the doctor. And lastly, nurses have to give a detailed education to the patients on what will the drug cause to the patients, including the medication side effect. After that, nurses have to monitor the patient's condition if there are any side effects such as vomiting, nausea, or GI upsets. Cephalosporin may also cause rashes and infections like Clostridium difficile that can cause severe diarrhea if consumed for too long. Lastly, nurses have to make sure and check for improvement on the patient's condition. Nurses have to again educate the patients on the medication side effect and adverse effects before discharging patients. Nurses have to make sure the patient is not on the antibiotic for too long, as it can cause antibiotic resistance.
Next, health teaching for the patients. Let's start with some basics advice for using cephalosporins. Let's start with general. First, complete the course. Always ensure patient complete the prescribed antibiotic course, even if they feel better before finishing it. This helps prevent bacterial resistance. Second, allergic awareness. It's crucial to ask patients if they have a history of allergies, particularly to penicillins or other antibiotics. Allergic cross-reactive can occur. Third, proper storage. Remind patients to store oral suspensions as directed. Most may require refrigeration to maintain effectiveness. 4. Timing of doses. Encourage taking doses at evenly spaced intervals to optimize the antibiotic effects. Lastly, avoid alcohol. For some cephalosporins like cephalosporins, alcohol consumption can cause unpleasant side effects such as nausea, vomiting, or flushing due to a disulfiram-like reaction. Next, let's discuss side effects. First, common side effects. These include mild diarrhea, nausea, vomiting, or stomach upset. Most of these are temporary and resolve on their own. Second, serious side effect. Patients should be advised to seek immediate medical attention if they experience severe diarrhea. Allergic reactions such as rash, itching, or swelling, and unusual bleeding or bruising are also red flags. Third, drug interaction. Cephalosporin can interact with medication like anticoagulant. It's essential for patients to inform their healthcare provider about all the medication they are taking to avoid complications. Finally, let's talk about diet during cephalosporin therapy. First, with food. Taking cephalosporin with food can help minimize stomach upset, especially with oral like cephalosporins. Second, hydration. Advise patients to drink plenty of water to stay hydrated and support the kidney in excreting the drug effectively. Third, probiotic support. To reduce the risk of diarrhea, patients can consume probiotic-rich food like yogurt or take a supplement. Encourage them to discuss this option with their healthcare provider first. So that's all from us. Thank you.